No more prostate enlargement. The prostate is the largest accessory gland in men and is an organ that only men have. Because it is arranged in front of the bladder like a guard, people named it prostate. Although the normal prostate is only the size of a chestnut and weighs about 15 grams, its role in the human body cannot be underestimated. The prostate can secrete prostatic fluid and maintain male physiological functions. It is also the main switch for normal urination and urine control. 1. Why does the prostate proliferate? Age and androgen stimulation are the most important causes of prostate hyperplasia. Prostate hyperplasia is a very common phenomenon in elderly men. About 40%–50% of men over 50 years old have prostate hyperplasia, and men over 80 years old have prostate hyperplasia. About 90% of men have prostate hyperplasia. Therefore, don't think that prostate hyperplasia is a scary disease. In fact, it is also a normal change with age, just like people growing white hair. In fact, early prostate hyperplasia does not produce symptoms. Only when the hyperplasia reaches a certain level will it lead to a series of symptoms. Moreover, not all benign prostatic hyperplasia will cause clinical symptoms. Some people may not develop the disease for life. 2. What are the symptoms of prostatic hyperplasia? Symptoms of prostatic hyperplasia generally begin to appear around the age of 50, and become more obvious after the age of 60. Symptoms of prostatic hyperplasia can be divided into 3 stages. 1. The initial stage is the stimulation stage. The main symptoms are frequent urination, urgency, urinary incontinence, and increased nocturia. At this time, the symptoms of dysuria are not obvious. Then as the disease progresses, it enters the 2. Compensation stage, residual urine occurrence stage. At this time, the symptoms of the stimulation stage continue or worsen further, and at the same time, the manifestation of dysuria appears, such as hesitant urination, dysuria, intermittent urination, incomplete urination, dripping after urination, etc. At this time, if no intervention is allowed to allow the disease to progress further, it will enter the 3. Bladder function decompensation stage. At this time, urine retention will occur, and severe cases may also cause hydronephrosis and renal insufficiency. Therefore, although prostate hyperplasia is a common phenomenon, once symptoms appear, you must not ignore it. If you do not treat it in time and allow the disease to progress, it may lead to a series of serious complications. Prostate-specific antigen, PSA, the normal range is 0 to 4 Ing per milliliter. PSA is a specific indicator for predicting prostate cancer, but an increase in PSA does not mean that you have prostate cancer. The doctor will make a specific analysis based on the situation.